This is a presentation on Neisseria meningitis, also known as meningococcal disease, by Cadence Shepard. Starting with the history of this disease, it was not formally discovered until around 1805 by Jasper Vissot. He was a Swiss general practitioner, and in the 19th century, the prognosis was so poor that it was rivaled by the plague and cholera. They started with therapeutic approaches that evolved around the 1890s through the 1980s. There also was a German physiologist named Emil von Behring, and he found that this disease could be cured by injecting humans with serum that they recovered from patients, but they did not understand the concept of antigens or antibodies. They just knew that something in the blood was helping cure this disease, and that was a start. Moving on to the transmission of Neisseria meningitis, the most common way to contract this disease is through spit or mucus activities, such as the examples listed here: coughing, kissing, sharing drinks, sharing eating utensils, sneezing, and there are quite a few other risk factors that we'll get into as well. This is an illustration of how transmission occurs. You can see on the left-hand side that it can be contracted through the mouth or the nose, leading to the back of the nasopharynx. And there will be two phenotypes of Neisseria meningitis. There's a commensal phenotype and the virulent phenotype. Now, when the cells are contracted into the nasopharynx, it will cause cell proliferation into the human mucosa. And with the combination of the virulent phenotype and commensal phenotype, that will cause the invasive variant. As you can see on the right-hand side, the bacteria cell will invade the blood vessel. This is a diagram of the trends in meningococcal disease between 2006 and 2023. And you can see the blue, green, and purple groups did have very high trends starting in 2006. But as the years have gone by, they have found more treatment for these cases, and the trends have gone down a lot. But there was a small increase during 2022. Getting into some of the characteristics of Neisseria meningitis, the cultivation for this bacteria is aerobic or facultative aerobe, meaning that these bacteria will thrive in an oxygen-saturated environment. The gram reaction is gram-negative. This just means that they have a specific cell wall structure, which is characterized by a thin layer of peptidoglycan and outer membrane, and this will cause them to stain a pink or purple when doing a gram stain, as you can see by the picture on the left. And they are bean-shaped. The arrangement is diplococci, which you can also see in the picture on the left because they are formed in pairs. And the movement for these bacteria is non-motile. They don't have any flagellum. They are fastidious. They will grow best on enriched media, such as a blood agar. And they will test oxidase positive. They actually oxidize both glucose and maltose. And when testing for this in somebody, their cerebral spinal fluid will be cloudy. When culturing Neisseria meningitis in a lab, the most common medium used is a blood agar, and images D and E on the right show a very good growth of the colonies for Neisseria meningitis. As you can see, they're a grayish color, very round, with a clearly defined edge, and they also look a bit moist, almost glistening, and those will be some distinctive signs of Neisseria meningitis. In some laboratories, they will use other mediums, such as a trypticase soy agar, a supplemented chocolate agar, or a Mueller-Hinton agar, and the only difference with these would be the nutrients that are used within the medium, and this just depends on what the bacteria will thrive off of when culturing them. There are actually a handful of clinical types of Neisseria meningitis that we're going to dive into, and starting with number one is bacterial, And this is obviously caused by bacteria. It can cause permanent problems in the brain, and it spreads between people in close contact with each other. And this is the leading cause of bacterial meningitis. Now, number 2 is viral meningitis, and it's most commonly caused by non-polio enteroviruses. And this is the most common type of meningitis. It is less severe, and most people recover completely without treatment. And the third type is fungal, and this is caused by breathing in fungal spores. And this can actually be very serious for people with weakened immune systems, and it can be difficult to diagnose. Moving on to a few other types of meningitis, we have parasitic meningitis, and this is actually another rare type of meningitis caused by parasites. And most of these parasites are found in the dirt, in feces, or just certain animals or foods. Next being aseptic meningitis, and this is a general term for inflammation of the meninges where no bacteria are found. It can be caused by viruses, fungi, or just a reaction to certain medications. Next being carcinomatous meningitis. Now, this occurs when cancer cells actually spread to the meninges. And the last one being post-traumatic meningitis, and this results from a head or brain injury, which causes inflammation of the meninges in the brain. Getting into the risk factors of developing Neisseria meningitis, you are at a greater risk if you are less than a year old, a teenager, or early adult, especially if you smoke or are exposed to secondhand smoke. Another risk factor is having a spleen injury or no spleen at all, having sickle cell disease, living in the same area as a lot of other people, such as college campuses or military barracks, taking complement inhibitor medications, or visiting areas outside of the US where meningococcal disease is more common, like sub-Saharan Africa. Signs and symptoms of this disease would be being bothered by bright light, diarrhea, fever, headache, nausea and vomiting, and even a skin rash that looks dark, discolored, pinpoints, or bigger areas that look like a bruise, and also having a stiff neck. Some other signs and symptoms would be confusion and irritability, feeling sleepy, difficulty walking or staying upright because of balance issues, grunting, moaning. You can also have joint and muscle pain or a loss of appetite. When looking for signs and symptoms in babies, it will be a little bit different because they will not express themselves the way that a teenager or adult would. Some of these signs include irritability, twitching, flopping, being very tired, refusing to eat, and a big physical symptom would be a bulging soft spot on the skull. And diagnosis for meningococcal disease, that can be diagnosed through the microbiology lab using culture and PCR techniques. Some other techniques that are used would be something called a spinal tap, where they collect the cerebral spinal fluid, and that can also be sent to the lab for testing, as well as blood sampling, a gram stain, or a bacterial culture, and the bacterial culture is considered the gold standard test for this diagnosis. Now, luckily, there are quite a handful of treatment options for Neisseria meningitis. Number 1 being antibiotic treatment, such as ceftriaxone plus, Rocephin, or penicillin, depending on what your doctor might prescribe, as well as corticosteroids to reduce damage to the nervous system. They may also treat you with IV fluids and medications to treat low blood pressure, as well as oxygen therapy, because oxygen is very beneficial to the brain. And they can also choose to do surgery to treat dead or damaged skin due to the rashes that people can form from this disease. With all that being said, I would just like to say thank you for taking the time out of your day to listen in on this presentation, and hopefully you gained a little more insight on Neisseria meningitis that can cause meningococcal disease. And if you had any questions or comments, please reach out to me and I will be glad to answer them. Thank you again for listening in to this presentation. I hope you enjoyed.